Hi everyone, Dave Sheehan here from Connect. I'm introducing a conference edition of the Connect Show. 2021 International Virtual Conference is coming up on the 23rd of May, just in a few days' time. We've got some presenters who will be giving a little spiel about what they'll be talking about. So make sure you tune in and listen up to our fantastic presenters for the 2021 conference. We've got John Gibbons, Whitney Lowe, Ruth Werner, Robert Libbey, and of course James Waslaski from the US. So stay tuned.
Hi, I'm James Waslaski, and I am incredibly excited to be teaching at the virtual conference in Australia on May 23rd of this year with some incredible colleagues. I'm an author and an international lecturer, and I'm teaching one of my favorite courses, which is releasing multiple nerve compression patterns of the lower body. So we'll be looking at things like bulging discs, herniated discs, ruptured discs, iliosacral torsions that unlevel the sacral base. We'll be looking at things where with that iliosacral torsion, there's an unlevel sacral base causing ligamentous and nerve-related patterns. We'll be looking at things like where the femoral nerve gets scarred down between iliacus and psoas if there's a strain. So tibial torsions. We'll be looking at open and closed kinetic chain of the feet that can affect nerve pain of the lower extremity. So you don't want to miss this one. This is one of the best workshops I've presented across the globe. And we'll see on May 23rd with my friend David Sheehan and some incredible colleagues from across the globe.
Hi, my name is Ruth Werner, and I am the author of A Massage Therapist's Guide to Pathology. And I have had wonderful times presenting this year for the Massage and Myotherapy Australia Association. And now I get to come back to visit for the conference on May 23rd. I'll be there with some of my very best friends. And my time with you will be spent on the intersection between what we understand now about massage therapy in the context of chronic pain. It's going to be a great time together, and I'm looking forward to seeing you there.
In this video, I'm going to show you some soft tissue techniques for the adductor muscle group. So the adductors, starting with the smallest, we've got pectineus, and then we've got adductor brevis, then adductor longus, magnus, and then finally we have the long one, which is called gracilis. Gracilis will come down to the pes anserinus, which means the goose foot. Magnus has quite a large insertion. It's got an insertion point onto the adductor tubercle, which is onto the distal part of the femur. I do have a knee here. And so the adductor tubercle would just be here on this area of the femur. And then also there's a ridge at the back called the linea aspera. And then most of the adductors will attach to that. And a lot of them will come from the ramus of pubis. Now, the gracilis is known as the long adductor. And the other four adductors are known as the short adductors, okay, because they do not cross the knee. So that means even though an adductor longus is called longus, it's still classified as a short adductor. So the first four will work on the hip, so they are adductors and internal rotators, whereas gracilis will also work on the knee because it will medially rotate the tibia in relation to the femur and also will assist the hamstrings in flexing the knee. This is a nice way of treating the adductors compared to maybe the standard way where the patient is sit in with the leg to one side and you can treat, because what this does, it allows me to have access to it. Just be careful, obviously, where the shorts are located, yeah, because it's a private area there. So what we're going to do is the patient's going to bend the knee and straighten the knee, and I'm going to work as the person is working through flexion and extension. And it works really well. So let me start. I've already put wax on the patient, and the wax I use is from Songbird, and it's just a fascial wax, and it works really well. And what we're going to do first of all, I am going to start around the adductor tubercle area with my hand positioned like this, with my thumb leading, my arm is straight. So it's like a gliding technique. And my patient is literally, when you're ready, please, Max, you are just going to slowly flex and you are going to extend as I glide down through those tissues. You okay? It's a sensitive area of the adductors, so try not to use too much pressure. If you use too much pressure, you'll also restrict the motion coming through that. Okay, so I'm going to go as far as I feel is appropriate. I'm going to change my hand position just to show you that we can use alternative positioning here. Coming through. Knees and off. Nice and slow. So the patient is controlling the flexion and extension. Bend my knuckle in on my thumb, which allows me to go a little bit further from there. I can also, if I want to, with this hand, I can control the flexion and extension motion, so I can control it passively. So I can then glide through. You will get naturally the fibers of the vastus medialis here. And if I go a little bit more posterior, I will get the semi-membranosus and also the semi-tendinosus. Okay, because naturally the adductors fill the space in between. So I'm just going to glide through them. And these techniques work really well. If you don't like the position I'm showing you, you can use fingers. You can reinforce. You might start off with this one. When you're ready, please, off you go. So you just glide in through. It does specify an area. You might be able to feel a bit more depending on your experience level. You okay with that pressure?
Yep.
Coming through there. And that works quite well. If I come around, you can put some wax on the forearm and then you can just drop down from here, okay? But if I start with him a bit more an extension, so I just need to be out of his way from there. When you're ready, off you go. So he is going to flex and I can glide through there. Okay, the surface area is wider, so potentially you could use a little bit more pressure. You can also come in this way as well when you're ready, and you can glide through there. Okay, so you can just work all the way through. I don't tend to work too much around the pes anserinus because one, there's a bursa and it's a conjoined tendon with a sartorius and a semitendinosus. So it tends to be a little bit irritated around here if you do too much work. So I tend to come off the tendon components and work mainly into the muscle attachments here. So what we've done some soft tissue work, yeah, focusing on the adductor muscles of the hip joint. I hope you've enjoyed the video.
Hello everyone, Whitney Lowe here, and I'd like to invite you to the Massage and Myotherapy Australia 2021 International Virtual Conference. This is going to be a great event with some outstanding international presenters from all over the world, and I'm delighted to be a part of this. I'm going to be talking about some of the key things that we want to consider in our practice when we look at interpreting research and determining what's really true and why does it matter for us. So we'll look at some of the key things that we've had in recent research findings and how they impact our practice to try to help us become the best practitioners that we can be. So please join me and a good group of outstanding presenters from around the world for this wonderful event, and I'll look forward to seeing you then.
Hey everybody, I'm Robert Libbey, registered massage therapist and instructor of ligamentous articular strain technique. I am here today with you. I'm so proud and so honored to be part of the Massage and Myotherapy's virtual conference that's going to be happening on May 23rd. This is going to be an amazing, amazing day. I'm going to be talking to you about ligaments. There's a ton of new information that you need to know in order to help your patients. So we're going to talk about what they're made of and why we've got them. We're going to talk about how they get injured. We're going to talk about the biopsychosocial implications about ligamentous and joint capsule tissues and basically just injuries in general. I'm going to tell you about a little project that I did for my new book on ligament pain referral patterns, where I was able to document all of the neurological innervations for the joint capsules and ligamentous tissue for the full body. We're going to talk about the pain referral patterns right there. We're going to talk about some armoring, some protective mechanisms, about how that all comes into play with all of our patients that we see. We've got some timelines for healing now. These aren't the typical acute, subacute, and chronic regular timelines that you learned in school. This is all based on research, so we're gonna update you guys on the timelines. We're gonna talk about some top-down and bottom-up influences that we as clinicians have with our patients, and how just changing our terminology and narrative about how we communicate with our patients can actually improve your outcomes. And then if I can get myself through all of this in an hour, then we're gonna have some time for some Q&A afterwards. So it's gonna be an amazing hour for me. I'm gonna be talking really quickly. Hope you guys have got lots of coffee in you, because I'm gonna go really quick because it's a ton of information I really want you guys to implement into your practice right away.
My name is John Gibbons, and I am an osteopath, a lecturer, and also a multi-published author of many books. So I've written the MET book, the glutes, K-taping, the pelvis. Recently was my nerve book, but the talk I'm going to be doing is all about the vital shoulder complex. So the hour's lecture is basically talking about the anatomy of the glenohumeral joint and discussing the associated joints of the AC, the SE, scapular-humeral rhythm. And then I'm going to be talking to you about the pathologies of the shoulder, the conditions, a little bit about rotator cuff, AC joint sprains, referred pain like the visceral, how the gallbladder and the liver refer pain to the right shoulder, the spleen refers to the left shoulder. So I'm going to be discussing things like that. I'm also going to discuss a bit of the thoracic outlet and the conditions associated to that, as in like the scalenes, the scalenus anticus syndrome, and pec minor syndrome and things like that. I run a company called the John Gibbons Body Master Method, where I focus on face-to-face and also online courses. You will see below there is a link to my website and also a code you can use at checkout to get a discount off the courses. Thank you again, and I hope you enjoy my presentation in May.